Good morning. Cole Schramm here, student physical therapy at the University of Marion Physical Therapy Department. I'm going to talk to you a little bit about my current level of clinical reasoning in musculoskeletal practice. Uh, Reasonably, through what little clinical practice I have had in the pro bono clinic and then on my clinical rotation this summer, uh, I think that I have drawn from components of A, B, and C. That being said, I think the majority of my clinical reasoning skills reside in schematic A, being able to apply my knowledge and experience to the problem, patient, or situation. Especially on my clinical rotation this summer in a skilled nursing setting. A lot of what I did with musculoskeletal injuries was um, drawing from what I had learned in class previously within the texts and information from the teachers and the evidence, and then applying it to the problem, utilizing an intervention, and then getting that feedback from the patient to determine whether or not it's working, and if it was, you would use it again. We did that a lot with modalities and some manual therapy techniques. From schematic B and schematic C, especially in the clinic with my mentor this last semester, trying to utilize the evidence, but then rationalizing why I'm doing what I'm doing. I think that's a good. I think that as a physical therapist, that's a component that you should always carry with you is being able to explain why you made the decision that you did, therefore, so you don't get yourself in trouble, and you always have a reason to explain to the patient and to other healthcare providers and professionals. Um, but then in schematic B, coming up with what you already know, but then coming up with your own idea or your own hypothesis. I had the opportunity to get creative a little bit during my clinical rotation this summer. Um, that being said, I want to talk a little bit about my goals. Um, my primary goal is to always be continuing my education and to be up to date with the current level of evidence available, to work from that foundational base of information, and then to work hard to really know my anatomy and be able to apply it in every situation, and then begin to formulate a working hypothesis in every scenario based on tests and measures that I use, based on trial and error, and then based on patient feedback.